community itself. And I think if you could even have a partnership where there is the true private-public partnership, this could grow into a much bigger organization and maybe serve as a true non-profit, allowing a lot more doctors and nurses and others to volunteer and have the paid staff to take the services, I mean the necessary services, give the necessary services. And I want to now introduce and invite.
We just want to also recognize the mayor of Plano who's
sorry.
arrived.
Yeah, I'm so sorry. I know Plano Mayor Harry LaRosiliere. I hope I'm not mispronouncing your name.
You said Harry perfectly.
Thank you. So he is going to be speaking, I think, a little later. That's okay. And also Tom Harrison, the city councilman from Plano. Thank you so much. So at a time when bashing corporations has become like a second business for a lot of people, especially in the younger generation, my children, I hope my son's not listening. It's really heartening to see Capital One that is really involved in doing so much good in their community, in the communities that they serve. And under the visionary leadership of President Sanjeev Yajnik, Capital One has embarked on a serious plan to reach out to their surrounding communities. Our clinic is very fortunate to have found a true friend and partner in Capital One. And please help me welcome Chief Financial Officer of Capital One, Mr. Girish Bachani, to say a few words about their corporate citizenship.
It's an honor to hear the things that you guys have to say. So thank you very much for the kind words, Judge Self, and thank you very much, Dr. Joseph, as well. This is just I love this partnership that you see government officials, you see corporations, and you see the community kind of getting together and making it happen. And you see so many individuals, particularly Mayor Harry and others who have spoken as well, to come together and encourage projects like this and make it grow. And Capital One is proud to be part of it. Capital One has about 5,500 associates in Plano. We don't want to be a guest in the community. We cannot be a guest in the community because all our associates live in Plano, Frisco, and we get so much from the community. It is just a blessing to be here. And we are really thrilled to be part of this organization, and hopefully we'll continue to grow this organization in the future and partner even closer. So thank you very much for inviting me.
I want to thank Mr. Bachani for those comments, and together we can do a lot to improve the health and bring about happiness in our communities. Now I would like to introduce Dr. Ruby John to say a few words about her experience seeing patients in our clinics. She joined us nearly 6 years ago and is very much admired by her patients for her care and compassion.
Thank you, Dr. Joseph. Like Dr. Joseph said, almost 5 years, but what a privilege to be part of such a great nonprofit clinic. So what I'm going to do today is kind of focus what I'm talking about on the patients that we're treating and the type of diseases that we're treating, how we remain unique compared to the other clinics in the area. So who are we treating? A lot of the patients that we see who do not have insurance are our IT consultants, those who are contractors, the small business owners and their employees, our daycare teachers, those who are recently divorced, post-incarcerated patients, our college students, those who are undocumented. And I would be honest to say the most complex of all of our patients would be the ones that are hospitalized after years of no medical treatment, who are admitted for uncontrolled diabetes, blood pressure, a new diagnosis of heart failure, anemia, thyroid disease, and you name it. And upon discharge, they have no established primary care physician. So they're sent to our clinic. And all the medical diseases that was just explained, that one patient has all of those, and they are complex coming in. So we as a primary care clinic are trying to maintain those diseases so they are not running into complications. We do struggle with some of our resources and with our referrals. as a heart failure patient would need to see a cardiologist, but we do struggle with the patient's finances and then ours with our resources. We're thankful who is working along with us, but that's where we try to maintain our patient from a re-hospital admission. So what are we treating in the clinic? The most common medical issues that we are seeing now, in my clinic mainly too, is diabetes, blood pressure, hypercholesterolemia, obesity, and depression. And I truly believe the goal of the medical management, we can give medication all day long, but if there is not an absolute counseling and patient education for these medical diseases, I don't think anything will change. So the lifestyle modification is exactly what we try to stress on. It is the activity that needs to be increased and the food choices that are being supplied for that patient. The goal then, if the patient is pre-diabetic or pre-hypertensive, our goal to tell that patient, don't get the diagnosis. How can we maintain those lifestyle modifications to prevent actually getting the diagnosis? And if they are diagnosed, how can we maintain and prevent the complications of those diseases? So it's not easy, but it does take the time and the education and the support, because the last thing we want our patients to do is to be readmitted for those complications. The last other main thing that we are doing is age-appropriate cancer screening for all of our patients who come in, again, have not had medical care. We're able to provide referrals for mammograms, do well woman exams, the pap smears, prostate exams. We do struggle with some colonoscopy referrals, mainly because of cost, but who can, we are thankful for that, and for Moncrief also allowing us to work with us for colon cancer screening. And last but not least, how are we unique? And as Dr. Joseph always says, we're not just that cold and cough clinic, but we truly are a continuity clinic. We want to care for our patients, those with chronic diseases. We're going to see them every 3 months to maintain them. We can't do everything for our patients, but boy, we can do something, and we're so grateful that we have the clinics to do that and where we are now. So thank you for being here and to allow me to share what's going on in the clinic. It's one thing to hear it from me as a clinician, but it's great to hear it from the patient himself. So at this time, I want to introduce Mr. Benjamin Estrella, who will come and give us a little insight from his side.
Thank you, Dr. Irving. As mentioned, I'm Benjamin Estrella, and I am a regular patient of Plano Primary Care Clinic. When I was invited, I thought this is the best time for me to say that me and my wife is so thankful and grateful that Plano Primary Care Clinic is here, because I'm one of the, I can say that, beneficiary of their good deeds. I've been here, I've been a regular patient way back, for regular checkup and ordinary illnesses. But I want to share something that 2 years ago, exactly the same month, I asked to be given an appointment because when I woke up, I'm not feeling well. My chest is pounding. When I measure my BP, it's really, really high. So I was so thankful that I was accommodated, and we proceeded in the clinic, and I was diagnosed with an atrial fibrillation. I was so thankful. The doctor who attended to me is Dr. Solanki, the lady. Yeah, the lady. But normally it's Dr. Solanki, the man, and but I was surprised when I was subjected to the EKG because the technician, when he first saw the result, as if he was not convinced. So I saw in him that he wanted to see something, but over and over the same result appeared in the EKG. So it was referred to Dr. Solanki. And when Dr. Solanki saw the result, outright, he advised us to move to the next building, which is the Plano Medical Center Plano, and go directly to the emergency ward. And there, I presented myself. At first, they they asked me to see it. But when I presented the result, the one that is attending to us immediately guided me inside. And when I said to them, can I pee? No, you don't have to pee. And all the gadgets were, you know, put in my body. And then I said, this is something serious, you know. So I was so thankful that I was given the chance to be diagnosed. And since then, the clinic has been taking care of me, watching my blood, you know, condition. And because of that, I can work normally, you know, although I'm taking some medication. And you know, I am so grateful and so thankful, first of all, to the Plano Clinic, to all the doctors and the staff. I know that even when I ask for appointment, they know that it's me. They really, they already know my voice. Oh, it's you, Mr. Estrella, yes. So, you know, this is the best time for me to say thank you very much for the primary care clinic of North Texas. And, you know, me and my wife truly benefit from, you know, the care that was given to all of us. You know? And I know so many so many has been benefiting from the what the clinic's doing. So I don't know how to express my appreciation, but you know, I'll never forget that because of this clinic, I'm still here, and my wife, you know, we are, you know, the beneficiaries of the good deeds of this clinic or organization. To all of you, thank you very much.